Hello, my name is Christian Chandra with class student number 102, and today we are with SGD B10 and we'll be presenting about viral sudden sensorineural hearing loss. This is our member list. I will continue with introduction. Sudden sensorineural hearing loss is defined as hearing loss of sensorineural type that are not a result of mechanical blockage from wax, fluid, or foreign object buildup of 30 decibels or more. SSNHL prevalence rate is estimated around 5 to 20 cases per 100,000 population. The possible etiology includes viral infection, vascular blockage, aberrant cellular stress response, and immune-mediated pathway. The etiology can only be determined in around only a third of the patient. Specific to viral infection and SSNHL, many research have suggested a link between viral infection and sensorineural hearing loss. Because of its complex burden in determining its exact etiology, management of SSNHL related to viral infection still remain varies and may found to have various results. These are the problem formulations. These are our purpose of writing. And these are the benefit of writing that we are hoping to achieve. Next.
Hello everyone, my name is Mahatma. With last digit of my student number is 130. Now the definition. The sudden sensorineural hearing loss is a ear, nose, and throat emergency condition. This condition commonly happens and encountered in the audiologic and otolaryngologic practice. The sudden sensorineural hearing loss makes the patient can hear the sound of 30 decibel or greater over at least 3 contiguous audiometric frequencies and in the occurred approximately 72 hours. The hearing loss that happens to the patient may vary from mild to profound, and it can be temporary or permanent. This condition is mainly idiopathic and still have unknown cause. That's from me. Now my friend will continue the presentation. Thank you.
Thank you. Hello everyone, my name is Huliana. My student ID number is 2002511080. Now I'd like to continue the presentations with the epidemiology. Epidemiological studies reveal that the prevalence of sudden deafness is rising every year. Sudden sensorineural hearing loss appears to be becoming more common as the population ages, but the specific number of prevalence in the world remains unknown. Current study shows incidence estimated about 60,000 to 65,000 new cases of sudden sensorineural hearing loss are identified in the United States every year, while in Germany, the prevalence reached 160 cases per 100,000 individuals. Prevalence also shows that the men are slightly higher than the women. Also, the number of cases rising proportionally with age. So older people has a higher incidence than the younger people. I think that's it for the epidemiology. The presentations will be continued by my friend. Thank you.
Putri Rahayu Indrayani with my last 3-digit number is 161. Now I will explain about the etiology of viral sudden sensorineural hearing loss. The etiology of sudden sensorineural hearing loss itself remains unclear, so it is usually classified as idiopathic because the causative factor is not identified in most cases. The potential cause of SSNHL include viral infection, vascular disorders, autoimmune disorders, neoplasm, neurological disorders, and ototoxic drugs. The types of viruses involved in these cases include cytomegalovirus, varicella zoster virus, herpes simplex type 1, herpes simplex type 2, rubella, measles, rubella, HIV, lymphocytic choriomeningitis virus, West Nile virus, and mumps. For hepatitis virus infection has been correlated with SSNHL only in a small number of case reports. The table on the slide shows that each virus can cause different types and degrees of hearing loss. Okay, that's all from me. The presentation will be explained by my friend.
Hello everyone, my name is Putri with reading number 202. I want to explain about the pathogenesis. So there are several things that are suspected to be the cause of sudden hearing loss, namely viral infection, vascular occlusion, abnormal cellular stress response with the cochlea, and immune-mediated mechanism. But there is no exact process that can explain about the pathogenesis. The three mechanisms that have the greatest potential for viral infection that cause the hearing loss are through viral infection of the cochlear nerve or corneuritis, or infection of the fluid space or cochleatis through the reactivation of latent virus and the virus that trigger antibody response such as immune-mediated or stress response. The first one is about the direct infection. So viral in viral infection is believed to be the biggest factor in the occurrence of SSNHL, seen in someone with measles, mumps, herpes family, influenza, and several other viruses experiencing sudden deafness. The entry of the virus into the body will infect the inner ear, which can enter through the blood during viremia or enter through the cerebrospinal fluid. The next one is the virus reactivation. Some virus can remain in the human body in latent state. This latent virus can generally be reactivated if there is a decrease in immune function. This mechanism is believed to be the reactivation of a latent virus present in the inner ear tissue can cause sudden deafness. Neurotropic virus are also believed to be infect the cochlear neurons in inactive state for varying length of time, then may be reactivated at a later date cause the feral neuritis.
Hello, doctors and friends. My name is Zacky Ar-Rafi last digit of SGD number 122. So today I will explain about the third and fourth theory of sudden sensorineural hearing loss pathogenesis. So the third theory is immune-mediated hearing loss. Immune-mediated hearing loss happens when virus trigger an immunologic response that develops pathogenic autoantibodies that attack phospholipid, also known as NTPL antibodies. These antibodies have a pathogenic effect on platelets and vascular endothelial cells, mediating the vaso-occlusive manifestation. These autoantibodies mediate thrombosis in the vessel of labyrinths, which can damage the inner ear, that resulted in sensorineural hearing loss. The last theory is stress response. Some researchers suggest that various stressful events can cause sudden sensorineural hearing loss, which could induce immune dysregulation. This event will lead to reduction in natural killer cell activity and an increase in interleukin 6 and neutrophils. Systemic stress is also involved in mediating and enhancing activation of NFKB. Increased interleukin 6 and neutrophil activate NFKB in the cochlear lateral wall will form a positive feedback loop that will lead to simultaneous activation of various NFKB activation pathways and eventually the development of serious sudden sensorineural hearing loss. Maybe that's all from me. My friend will continue the next part.
Hello, my name is Anastasia Gwyneth with my last three digits student number 09. I'm going to explain about clinical manifestation. Hearing loss, which is caused by a number of viral infections, can be congenital or acquired, unilateral or bilateral. This may have a correlation to a direct viral access to the labyrinth or the cochlear nerve, reactivation of latent virus inside, spiral ganglia, and immunoregulation of systemic viral infections. Clinical manifestation may include alarming pop just before their hearing disappears, a feeling of ear fullness, dizziness, and/or a ringing in their ears, such as tinnitus, trouble following group conversations, muffled conversation sounds, inability to hear well when there's a lot of background noise, difficulty hearing high-pitched sounds, and balance problems. Other causes of viral SSHL may include Lassa fever, mumps, adenovirus, and other viruses.
Hello, my name is Karina Devi with student ID number 200251189. I will continue the presentation about diagnosis of viral sudden sensory neural hearing loss. There are three bases for diagnosis viral sudden sensory neural hearing loss. There are patient history, ear microscopy, tuning fork test according to Weber and Rennie, and pure tone audiometry. Pathology of the external auditory meatus, middle ear, and severe systemic disease must be excluded. The diagnosis element of the current version recommended by the German S1 Guideline ISSHL, namely intensive history, special physical examination on NET, blood pressure measurement, ear microscope, hearing tests such as tuning fork and pure tone audiograph, and tympanometry, also preliminary vestibular testing. In SSNHL caused by virus, diagnosis using a biopsy specimen is not possible because the inner ear tissue is difficult to assess and the area doesn't regenerate, leading to catastrophic sequelae. Meanwhile, indirect diagnosis can be made by detecting IgM to identify primary infection. That's all from me. Thank you.
Okay, my name is Madekina Revisavita with the last digit number 197, and I will explain about the treatment and management. Sudden deafness or sudden sensorineural hearing loss is an otological emergency. Therefore, its management must be done quickly and effectively. SSNHL treatment consists of observation, oral steroids, intratympanic steroids, or combined oral or intratympanic steroids. Spontaneous recovery is known to occur within the first 2 weeks by 1/3 to 2/3 of patients. Another treatment of sudden deafness generally includes vasodilators. They are histamine, papaverine, verapamil, and carbogen. Next is hemodilution. They are dextran, pentoxifylline, mannitol, and heparin. Or antivirals is acyclovir and valacyclovir, because they have minimal evidence supporting efficacy and carry a high risk of adverse events. Vasodilators and thrombolytic are not routinely administered to patients, likewise with antivirus. Due to lack of supporting evidence, antivirus is also not prescribed. Other therapy may include 100 hyperbaric oxygen or HBO 2 to 2.5 ATA for 90 minutes daily for 10 until 20 treatments. However, HBO therapy is usually not feasible due to high cost, limited access, and time-consuming appointments. Okay, that's all for me. Thank you.
Hello, my name is Nita Aristania Devi and my ID number is 2002511138, and I will continue to explain about the treatment and management of sudden sensorineural hearing loss or SSNHL. Intratympanic corticosteroid therapy for sensorineural hearing loss is becoming more widely used, although its effectiveness has not been definitively proven. The protocol for treating sudden deafness with intratympanic corticosteroids consists of primary therapy such as intratympanic therapy as the first treatment for sudden deafness without systemic corticosteroids, adjuvant therapy such as therapy given concurrently with systemic corticosteroids. Salvage therapy is like therapy started after systemic corticosteroid therapy has failed. Treatment and management of SSNHL also includes educating the patient about the causes and interventions for this condition. SSNHL has different treatment goals depending on the degree of hearing loss. Maintaining current hearing levels and returning hearing to baseline are treatment goals for patients whose hearing can still be improved. On the other hand, counseling is carried out for patients whose hearing is not repairable, aiming to achieve repairable hearing and to return the premorbid hearing. Okay, that's all about the treatment and management of sudden sensorineural hearing loss. My friend will explain the next part. Thank you.
Hello everyone, my name is Nita with last year student number 111. I'm going to continue about the prognosis. Without treatment, 45 to 65% of patients with idiopathic sudden sensorineural hearing loss will regain their pre-loss hearing thresholds with average gains of 35 decibels. Its prognosis is influenced by a number of risk factors, such as demographics, the severity and length of the hearing loss, accompanying symptoms, and audiogram features. When compared to individuals with minor losses, patients with higher initial audiogram hearing thresholds after the onset of sudden sensorineural hearing loss typically have a slower rate of hearing recovery. Longer time between the development of this disease and the presentation to a doctor is inferred to mean that early treatment results in better hearing outcomes. Regardless of the method of time of treatment, sensorineural hearing loss of shorter duration has a higher chance of recovery.
My name is Karina, student number 2002511003, and I will explain about the differential diagnosis for viral sudden sensorineural hearing loss. Depending on the location, there are many other hearing problems that occur as sudden hearing loss. In the middle ear, there can be cholesteatoma, ossicular chain disruption, otitis media with effusion, and otosclerosis. In the pinna and external auditory canal, there can be obstruction of external canal by cerumen, by exostosis or commonly known as surface ear, or by foreign body, and otitis externa. Then in the tympanic membrane, there can be perforation or tympanosclerosis. Clinician must take diagnostic examination to rule out this differential diagnosis for viral sudden hearing loss. That is all from me. Thank you.
Hello, my name is Ketut Adelia Febrianti Puspa with the last 3 digit of my student ID number is 041. So we will continue with the last chapter 3, which is conclusion. So sudden sensorineural hearing loss is defined as hearing loss of sensorineural type that become an ear, nose, and throat emergency condition. While the prevalence is rising every year with slightly higher incidence in men and women, and also rising proportionally with age. Viral sudden sensorineural hearing loss caused by viral infection or reactivation of the virus such as cytomegalovirus, varicella zoster virus, herpes simplex type 1 and type 2, rubella, measles, rubella, HIV, and other type of virus that can be congenital or acquired unilateral or bilateral, while the treatment is consist of observation, oral steroid, intratympanic steroid, or combine of both. While the diagnosis is often by detecting virus in infected area of the body by assessing the body's immune response by means of specific antibody titers, while the prognosis depends on the disease process, its duration, its specific effect on cochlear structures, and the available of treatment. The last one, differential diagnosis is include cholesteatoma, ossicular chain disruption, otitis media with effusion, otosclerosis, obstruction of external canal by cerumen, exostosis and foreign body, otitis externa and perforation, tympanosclerosis. Next. Here are our references that we use for making the student project. Next. Okay, that's all from us. I would like to apologize if there is a mistake during our presentation. Thank you for your time and attention.